Hello, I'm Cindy Arenberg-Seltzer, President and CEO of the Children's Services Council of Broward County. Welcome to another edition of Future First, Focus on Broward's Children. As parents, we do whatever it takes to keep our children healthy and safe. We make sure that they ride in a car seat, we baby-proof the house to protect them from injury, we do our best to provide them with healthy and nutritious food. But did you also know that you can help protect your children from over 14 serious diseases? It's not just about the exotic ones like the recent H1N1 virus, but protecting children from dangerous diseases like measles, mumps, and whooping cough, among others. Joining me today to discuss how best to keep babies healthy and safe are the Broward County Health Department's Rebecca Hacker, Program Manager of the Women, Infant, and Children Nutrition Program, Rebecca Mille, Program Manager of Kid Care, and Ethel Edwards, Assistant Nursing Director for Immunizations. Good morning, ladies. Thank you for joining me.
Good morning.
As you know, as the mother of a 3.5-year-old, immunizations, very topical for me, as I'm sure many other mothers out there. Ethel, can you talk a little bit about those 14 diseases that we're facing?
Sure. Thank you, Cindy, and thank you for having us. First of all, I'd like to say a little historical that immunizations is one of the major public health accomplishments. I remember as a kid diseases such as polio, crippling effect of polio, measles, as you stated, whooping cough, mumps. Because of vaccines and immunizations, those diseases are practically non-existent here in the United States. However, underdeveloped countries, there's still diseases which can be imported here into the United States and affect our population. So it's very important that children be immunized. We have to look at new and re-emerging infections. Look at H1N1, influenza, that's a new virus. It's very important that children receive their vaccinations. Re-emerging are vaccines, the diseases that didn't go away. Pertussis, whooping cough is still around. Measles, there's a recent outbreak in measles in California a few weeks ago. Varicella, chickenpox, we have a vaccine for that, but we have had outbreaks. So immunizations are very, very important, and they're safe. The benefits of vaccines or immunization far outweighs the risk.
That's a really critical point, I think, because parents who are worried about autism, I mean, really that's the scare that has everybody worried, is this threat of autism. And that seems very real, and these diseases you're talking about are very elusive or not in the forefront of people's minds. So I just want, I don't want to scare people, but I want them to understand. I mean, my sister-in-law is partially crippled because of polio that she had as a young child. And I don't think we really think about those issues. Some of these illnesses are not just inconvenient. I mean, I remember having the chickenpox as a kid because there was no vaccine then, and it itched like crazy. That won't kill you necessarily, itching, although it felt like it, but some of these diseases are deadly.
Exactly, and here again, even though chickenpox, chances are, would not kill you, but children react to diseases differently. And some children's immune systems, if they acquire a particular disease, can make that illness more severe for them. Secondary infections can develop. So the idea is all children should be immunized according to the schedule. Now, there's one concern parents have, and that is, oh, there's so many. Oh, my child shouldn't be getting so many shots at one time. Children's immune systems are strong, and they can handle it. I remember DTaP, diphtheria, tetanus pertussis, polio, and measles. That was it. But because diseases, new and re-emerging diseases occur, we are fortunate that we've researched to develop vaccines to protect the new ones and maintain immunization levels for those that continue to exist or may reemerge. It's It's very important. We now have vaccines for meningococcal. And parents can remember when their children go to college. I mean, we've already heard in the news where students acquire a meningococcal infection.
Common term for that would be meningitis?
Meningitis.
Right.
And now we have a vaccine.
Wow.
So,
so for people who think, okay, it's only for infants, it's really not. These immunizations go on throughout their lifespan?
Their lifespan, exactly. Throughout their adolescent life, and of course later on for adults, but throughout the lifespan. We try to get children, infants and children immunized through the course of from birth up until they're out of school. So there's certain periods of time that we stress the importance, 2, 4, 6 months, 12 months, 15 months. Then we're trying to get the child ready for school, 4 to 6 years of age. And then we reevaluate when the child is 6th grade to make sure now, we want to make sure before they get out of high school, we can catch them.
And that importance is because there's a lot of people close together. Anytime you have gatherings of that makes the transmission of the disease so much easier.
Exactly.
And again, in South Florida, with this very transient population, we have a lot of people coming in from other countries that can carry these infections that we think are gone.
And also because of some of the vaccines being fairly new or fairly within the last 10 years, parents don't realize that there's this vaccine that your child needs for this particular disease, like hepatitis. There's a series of immunizations for hepatitis that families don't even know or parents don't even know that is available for their children or that their children need.
Absolutely. And one of the issues that we have dealt with all the time is educating parents on what their child needs, what their child received, and keep a record. Many parents don't keep a record of their vaccines and really may not know what their child has had.
And that kind of connects us to that whole medical home idea where your doctor can really keep track of that. And of course, through WIC and through Kid Care, those are portals to get connected.
Absolutely. You know, Florida does have a system called Florida Shots where every child's immunization record is entered into this system. And that's one of the things that WIC does. We serve about 20,000 children in Broward County, infants and children. And when a parent comes to the WIC program, they are requested to bring their WIC, their immunization record, and we will assess that record and let mom or dad know what the infant or child needs, and if they don't have a health care provider, we will let them know where they can go to get those immunizations. We also have an employee in the clinics educating the parents on the importance of getting these immunizations and the consequences if the children do not get the immunizations. Children that have come in from out of the country, she will also call these parents and speak to them so that they understand the time frames that they need to get these shots within and referring them to these very important resources to get the shots. Because, you know, we have so many people coming into to South Florida that are not familiar with our system. So this WIC employee plays a very important role in educating the WIC clients as to what the needs are.
Just as a reminder, WIC is Women, Infants, and Children.
Yes.
And what's the eligibility for that program, and how would people access it?
Well, I believe that our number is going to be shown on the screen.
Okay.
Anybody that gets food stamps or Medicaid can get WIC. Okay, we serve anybody 185% below the poverty level. You can call our number. We can give you all the information as to how to get onto WIC. WIC serves all the community if you fall into the eligibility guidelines. You don't necessarily have to be a citizen. So it's open to anybody that lives in Broward County.
And the age of the children?
We serve pregnant women, infants, and children up to the age of 5. We also have a very extensive breastfeeding program also. and we provide lactation consultants to the home for moms that are breastfeeding.
Excellent. So people who might be eligible, who that sounded like you, call the number on the screen.
Absolutely.
And then if you are enrolled, make sure you bring your immunization
Yes,
experts.
and we can help refer you to many other resources within the community for those people in need.
Excellent. Now, Rebecca, Mile, we have a lot of Rebeccas today. Kid Care is another important resource for parents who want to be connected to a medical home, who want to track their immunizations. Can you talk a little bit about that?
A lot of reasons. One of the main reasons that families don't get immunizations for the children is because they maybe can't afford a doctor visit. So we have, here in Florida, we have what's called Florida Kid Care, and it's part of the state and federal program. It's a free or low-cost health insurance for children. And we do have a representative at, several of the WIC clinics so that they can enroll if it is also on a sliding scale basis. And it covers everything that the child needs. It covers their doctor visits, it covers their immunizations, it covers sick, surgery, medical transportation in case of an emergency, everything the child needs, including dental. So there's really no reason. I mean, it's on a sliding scale basis. A family of 4 can make up to $42,000 a year and still qualify for a premium payment as low as $20 per household of children. So, there's really no reason for a family not to have health insurance. For the families that, there are some guidelines. You have to be a U.S. citizen or have a green card for at least 5 years in order to qualify for the subsidized premium. However, there is a buy-in component. So if a family is over the allotted income for their household, they can still buy into the program at the full premium that the state pays the provider and still get enrolled into a great insurance company. And that includes dental as well as the immunizations that the children need.
I'm so glad you brought that up, Rebecca, because there's so much confusion about health insurance, health care these days, and I really think it's important for our viewers to know that in Florida there is no reason for a child to not have health insurance.
That's right. It's amazing. Broward County has 12.9% of the uninsured children under the age of 19. That's approximately 47,000 children. And this program has been around for 12 years, or maybe even a little bit more than that. So it really is, and it's available to everyone. It's so simple to enroll. They can, families can go online and enroll online. The process takes about 15 minutes, maybe even less than that, and send it automatically. And within a few weeks, the child can be, or the children can be insured and get all the health services that they need through their own private doctors and get their immunizations through their own private doctors. It's an excellent program, and it's very, very affordable.